Are you one of the 30 million of Americans that suffer chronic sinus issues? Then this video is for you. I am Dr. Pavlina Suchanova, and I am general ENT, but I specialize in treating patients with chronic nasal obstruction and chronic sinus and allergy issues. Chronic sinus patient is one of the most common patients I see in my office. Many of my sinus patients are extremely frustrated, and they are basically tired of dealing with problems such as nasal obstruction, sinus pressure, sinus pain, horrible headaches, mucus that many times colored as well, bad breath, trouble sleeping at night, and problems with smell and taste. If you're experiencing a lot of these symptoms, then you have chronic sinusitis. What is that? Chronic sinusitis, as I explained to my patients, is basically inflammation of the sinuses. Sinuses are empty spaces that are in your cheeks, around the eyeballs, and the forehead. Basically, they act like airbags for a face. When you fall, you are not going to hurt your brain, and you're going to hurt your sinuses. They also act humidification, warming up the air as well. When they work great, it's very good, but when they stop working, patients suffer greatly. What happens during chronic sinusitis is patients have so much inflammation in their nose that it eventually blocks the sinus channels that drain the sinuses. When that happens, that's where the severe symptoms of the headaches, sinus pressure, and the pain and the chronic infections come. Most of the patients, of course, see their primary care doctor, have been usually on many antibiotics. They might have tried nasal steroids as well in terms of spray. They might have tried some saline irrigation. Sometimes oral steroids as well help. But if the infections keep coming back, then there's something more that needs to be done. When you make an appointment with me, the first thing we'll do after we collect very detailed history to see what treatment you have received, we'll look in your nose with a little camera, which is called nasal endoscopy. That's going to help me identify what your sinuses look like, what your nasal cavity looks like. Are there any other blockages such as deviated septum, which is the bone that might not be straight inside of the nose? Do you have any active infection? Is the mucus green or yellow, or is it clear? Some patients can also have nasal polyps, which would make the chronic sinus problems even worse. Once we identify the problems with a little camera called nasal endoscopy, most of the patients will also undergo what's called CT scan of the sinuses. This is a picture of the inside of the sinuses where my camera does not reach, to see whether there are any persistent blockages there. After we perform the CT scan, which is a painless 2-minute picture in my office, I may also start you on better anti-inflammatory treatment in your nose if you haven't been exposed to enough of the treatment. See if I can medically improve you. If I cannot medically improve you and your CT scan will show significant blockages in the sinuses, then it's time to discuss possible procedure or surgery. And this is where balloon sinuplasty comes in. Traditionally, the only way how to address blockages in the sinuses would be with what's called functional endoscopic sinus surgery. It's a mouthful, but what it basically means is we would take you to the operating room. We will put you to sleep with a general anesthesia. I still do sinus surgery in the OR for patients that are very severe, but based on my experience from the last 5 years, I have to say that many of the patients that I would have traditionally taken to the operating room, I can really help in office. And that's where the balloon sinuplasty comes in. Balloon sinuplasty is a minimally invasive procedure that I perform in my office using a very little balloon that's about 6 millimeters in diameter on a little wire. Now, what does that do? This balloon will dilate the blocked sinus channels that we would have identified on the CT scan. How does this procedure work? Once we identify that you are a candidate for the balloon sinus dilation based on the CT scan, your symptoms, and your treatment, we will schedule you for this procedure, and most of these procedures are covered by insurances. What to expect on the day of the procedure? To make my patients more comfortable, I do give relaxing medication and pain medication in the oral form. Take it home about 45 minutes before the procedure. So I think it's important that you ask a family member or a friend to give you a ride to my office. Once you see me in the office, I will proceed to decongest your nose with what's called afferent spray. And afterwards, I will place a little bit of a topical numbing gel in the nose. For most patients, I don't actually have to do any injection. So a lot of patients are always scared of that because that can obviously cause pain. But most of my patients, I'm able to numb very sufficiently using very potent local numbing gel. We let the gel sit for about 5 minutes, and then the nasal cavity is numb and we can proceed. I'm a big believer in making patients very comfortable during my procedure. And so I think it's really important that we have good relationship and you trust me. I'm going to keep you comfortable, and then I'm able to deliver that for you. We have a special procedure room set up for you in which you'll be laying down. You'll have a pillow as well, blanket. I even painted the room olive green. It's very calming color. And I think all these little things actually make the experience much better for my patients. We put in relaxation music on as well to keep you as comfortable as we can. After we get you all set up, I will use use a camera system to look in your nose while I use the balloon sinuplasty wand to dilate your sinuses. What to expect? It's very normal to feel some pressure sensation, and sometimes there can be some cracking heard as well. That's when, especially in the forehead sinuses, there are little bones that when they are dilated, they make sounds. All of these are actually an important part of making the sinuses open. So I always tell my patients, when you hear crack, that's a good thing because what was closed is now open. Balloon sinuplasty is one of my favorite procedures in the office because some patients actually report immediate improvement. I have one patient that was with me about a year ago, and he had chronic headaches and chronic pain right here in the left forehead for many years. And he's done all the right things. He's seen PCP, he's been on multiple antibiotics, prednisone, and flushes and sprays. But the CT scan that I performed for him showed that this sinus was completely obstructed. After the numbing procedure was done, of course, when I dilated this blocked sinus, as soon as I removed the balloon, he said, "Doc, I can feel it. The pain is gone." This is just something that makes me so happy. And so you may have similar pains and aches. And if I confirm that they're coming from blocked sinuses, we can definitely try to see if you're a candidate for the in-office balloon procedure. Depending on the number of the sinuses I'm going to dilate, the procedure can take anywhere from 15 minutes to 25 minutes. There is 6 sinuses that we can potentially dilate together. It's the cheek sinus, the sinus that's in the forehead, and then there's another sinus that's right in the back of the nose as well. After the balloon sinuplasty is done, really there is minimal discomfort or minimal bleeding because this is very, very minimal invasive. Again, there's no incisions. We use the balloon sinuplasty uses a little wire, and the wire goes first into where the blocked sinus opening should be, and then the balloon will follow. The balloon has a little red light on it as well, so sometimes patients can also see red light. It just means that I am correctly in the sinus and you are perceiving the light from the balloon. How is the healing time? So once you go home from the balloon sinuplasty, if there is an active infection in the sinuses that we have seen during the balloon sinuplasty, I usually place my patients on specialized medicated irrigations, so we kill a lot of the microscopic bacteria that are in your sinuses. I usually have my patients flush 2 to 3 times a day to really help with the healing. And I think that makes the patients much more comfortable as well. The first post-op visit is in about 10 days. Again, there was no packing in the nose. I mean, there's nothing in the nose. You will feel like you're having a cold for about 3-4 days, but then the congestion is better. And then on day 5 or 6, all of a sudden it feels more open, and then the sinuses feel more open. So many times patients on the first post-op visit in 10 days will tell me, "Dr. Suchanova, I feel so much better already." And so again, that's why it's important that you come for an evaluation, and we'll see if I can make you better as well.